Hey, so today I was in Ortho Trauma 8C1. I had a 65-year-old female patient. She presented to the ER with um, what she wasn't sure. She basically hurt her ankle. Ended up being a closed fracture. The patient was hanging out. She's actually from out of state, and she was here visiting her son. They were outside hanging out, and I guess his dog ran into her and ended up like his head, like literally knocked her leg and knocked her over, and then ended up fracturing her ankle up to the tibia. So, this particular patient, in terms of pain, obviously the onset was 2 days prior. It involved her left ankle. The pain was constant, like a sharp shooting pain. Any kind of movement really aggravated it. We used pillows and elevation to help with it. Wasn't really easy to ice because it was wrapped in like these thick gauze and an ACE bandage. And then obviously meds for treatment. She was on gabapentin for like the nerve pain. And Tylenol. She really didn't handle the opioids well, so she preferred not to have a Percocet. Her pain was a 7 out of 10. So in general, the patient stated that her pain was constant. Her pain meds were wearing off really quickly. So we just tried to keep her as comfortable as possible. We were planning for discharge. She actually left later in the afternoon. So vitals were good, 97.5 temperature, 68 was her heart rate, 140/83 was her blood pressure, so a little elevated. Let's see, respiratory rate, 16, 100% on room air, and then her glucose was 129, but I think that was taken right before she went into surgery, so I think that had a lot to do with adrenaline. She was alert and oriented ×4. S1, S2 sounds were present. No accessory muscles used. Lung sounds were present, and then no wheezing or crackling. Bowel sounds were normal and active. She urinated without pain. 5 out of 5 in all extremities except for that one leg. She had good capillary refill. Her skin was warm and dry. And then obviously we looked at the surgical incision under the ACE bandage. What we could. We couldn't really see it, but it was there. So she went in for an x-ray, CT of the left ankle with contrast, and then obviously had surgery on that ankle. She had screws and plates put in. So the problem was a fracture of that left ankle. So my nursing diagnosis for this patient was acute pain related to a closed ankle fracture, as evidenced by her pain score of 7 out of 10. And then short-term planning was that the patient will notify me of pain, her pain level during my 8-hour shift, some short-term interventions just to elevate and support that ankle, and then administer pain meds as needed to keep that pain level reduced. And then the patient did meet that goal. She let us know when she was in pain. And by discharge, she did specify that her pain was a 3 out of 10. So we were in a better place right before discharge. We made sure to go over the med reconciliation with her for discharge, and then also just to make sure that she knew how to ambulate well with the walker, since she wasn't really familiar with that. So, and that was my day. Thanks.